Welcome back to UofL Today with Mark Hebert on 93.9 The Ville. Dr. Erin Medlin is a doctor with UofL Physicians and a teacher in gynecologic oncology in the UofL School of Medicine. And we're going to talk about cervical cancer.
It's very good to be here. Thank you for having me.
Welcome. I'm glad you're here.
Good to be here.
Dr. Medlin. So what do you teach? You teach gynecologic oncology.
Exactly.
For those of us who aren't smart enough, what does that mean? What is that?
So I specialized in obstetrics and gynecology into gynecologic oncology and focus on women's cancers, specifically cancers of the female genital tract. So vulvar cancer, vaginal cancer, cervical cancer, uterine cancer, and ovarian cancer.
So you train the future medical students that want to go into cancer, right?
Exactly.
Okay. Well, very good. Well, we're glad you're here. Well, let's talk about cervical cancer.
Let's do it.
What's the disparity? We were going to talk about the disparity among cervical cancer in different women. So why don't you go into what the studies and research have shown?
Yeah, so there was a recent study that was published out of Johns Hopkins University that looked at health disparities and mortality in cervical cancer, meaning the death rate in cervical cancer. What the previous studies had neglected to do is account for hysterectomies. So when we look at women who've had a hysterectomy, obviously don't have a uterus or cervix anymore, and those women are no longer at risk for cervical cancer. And the previously calculated rates of mortality and incidence, they had included those women in there. So when they adjusted for that, they were able to see some greater disparities among Black and white women, specifically in the older population, especially those over the age of 85, and even over those over the age of 65. So we're seeing mortality rates in women who are Black as opposed to white about almost twice that in Black women than in white women.
Wow. Well, how many women in America die of cervical cancer each year? Any idea?
About 12,000 a year are diagnosed, and the mortality rate is much lower. I couldn't quote you a number right now, but it's not high, and the reason for that is that we do have effective screening programs that have lowered the rate of mortality in the United States over the last 30 years, really, since Pap smear screening came into effect in the late 70s.
Right.
We are seeing a decline, but we still have kind of leveled out over the last 5 years. The reason for that is women who die of cervical cancer are those who are not getting screened, have not been screened in the last 5 to 10 years, or who have never been screened.
So let's ask the obvious question. Why are Black women dying more from cervical cancer than white women?
You know, there's a lot of speculation for that. You don't see those disparities in the younger population. It may be tumor biology. Black women may have more aggressive histologies. It may be that Black women are not being offered as aggressive treatment as white women. That has been shown in some of the literature. It could be access to care and access to affordable health care. All of those are probably playing a factor into the disparities that we're seeing, but nothing has really shook out as a one cause for that.
Are we seeing that in Louisville? Is it any different than any other city in the
Louisville
U.S.?
is probably more so than in other cities. And the reason for that is cervix cancer is extremely high in the state of Kentucky, one of the highest incidents in the country. We have low access to care, so that is part of the problem. Socioeconomic factors play into that. And we have a disparity between Blacks and whites here, and I would anticipate that is seen in cervix cancer as well.
And so just the access to care, is that the main reason that Kentuckians have a higher rate of cervical cancer?
There is probably that. Smoking plays a big part into the pathogens.
How does smoking play into cervical cancer?
Cervical cancer is caused by a virus, HPV, the vast majority of cervix cancer. Smoking diminishes your ability to fight viral infections. HPV is no stranger to that. So while that immune system is going down, cervical cancer is allowed to rear its ugly head, and we see more in smoking populations. And unfortunately, the state of Kentucky has a high prevalence of smoking.
So our bad habits as Kentuckians are leading to more cervical cancer than the rest of the country. Vaccinations, the HPV vaccine, there's been a lot of controversy about it. And I read an article, I think it was in Time magazine not too long ago, that said that the rates of young women getting the HPV vaccine was far lower than anybody anticipated. Why is that, and what do you recommend?
The reason for that, so yes, it is absolutely correct that the rates of vaccination are much lower in the United States and in a lot of other industrialized countries. Only about 30% of young girls and boys will complete the 3-shot series. About 50 to 60% of boys and girls will start the series, but only 30% complete the series. There are a lot of reasons that are playing into that. One is that initially, when it was marketed, it was kind of put off as HPV as a sexually transmitted disease, which it is, but it wasn't marketed as an anti-cancer vaccine. And that has played into some prejudices we have about sexual activity in young girls and young boys. People had theory that it would promote sexual promiscuity among teens. That has not shown to be true, but that still kind of plays into people not recommending it. We're also not seeing providers recommend it as much as other vaccines. So although providers are aware that there's a link between HPV or HPV virus and cervix cancer, as well as anogenital cancers and neurooropharyngeal cancers, only about 20% of providers are recommending it routinely. So it goes both ways. Both people are not seeking it out or have reasons that they don't want to get it, and providers are not recommending as much as we should.
All right, we're talking to Dr. Erin Medlin, who's a doctor with UofL Physicians and a teacher in gynecologic oncology in the UofL School of Medicine, and we're talking about cervical cancer. On that vaccine, it's the first vaccine that stops cancer, right?
Yeah.
And so, you'd think that most people around the world are thinking, holy cow, well, we ought to get that vaccine.
Absolutely.
But there's been some pushback, and even I think a former or a current UofL faculty member has said that, in her opinion, it causes more harm, potentially more harm than good. So what do you, as a physician, what do you tell the parents who come in and say, you know what, I've heard mixed reviews on this. I'm not sure what to do. My 14-year-old daughter, we think we ought to get her the shot, but we're not so sure about it. So what do you tell them? So
I tell these patients that it is a vaccine that prevents cancer. The majority of teens and even adults will clear the HPV virus. 70% of people will clear the HPV virus, but that ability dwindles as we age. You are likely to reacquire HPV later on in life. It is ubiquitous in our environment, and so you're likely to acquire it and could go on to develop cervical cancer. The studies that have been done with the HPV vaccine have given about 60 million injections. The risk of adverse effects is extremely low. A lot of the adverse events that we've seen in the media, some girls who have fainted or had a lot of these issues, have shown not to be related to the vaccine and caused a lot of smoke where there was no fire.
Right.
So as a healthcare provider for women, I absolutely recommend it. As a provider who takes care of young women who have cervix cancer who may die of this disease, I absolutely recommend the HPV vaccine.
All right. And if I get cervical cancer, well, I'm not going to get cervical cancer,
yes,
but you might. What are the odds that I can beat it? You said that the death rate was pretty low, but so are the odds, assuming I can get treatment early, are they pretty good that I'm going to live?
The odds that you will live are extremely good. Most cervical cancer in this country, because of screening, is caught early, and their chances of survival are close to 90%, even higher for early stage disease. And even advanced stage disease, it can be cured. We recommend that women get screening at appropriate intervals. Those intervals are different based on your age group, but that can help to catch cancer early or to prevent early lesions from becoming cancer.
And what are the things that women should look for that might lead them to believe they perhaps have cervical cancer, or do you just not know?
So there are some symptoms that can kind of heighten your awareness to maybe you have cervical cancer. If you're having bleeding after intercourse or abnormal spotting in between periods, that can be a sign of cervical cancer. Abnormal discharge, that's different for you. Those are really kind of the big things that may heighten you to cervix cancer, and really just making sure that you're seeing your doctor every year and reporting those complaints or concerns and making sure you're getting a pelvic exam when you need it.
How often should women get pap smears?
So it depends on the age. For women under the age of 21, pap smears are not recommended. From the age of 20.
Why not? What's
the reason
deal?
being is because most young girls will clear the HPV virus. We used to pap people at the age of 18 or 3 years after they started intercourse, and we were doing a lot of procedures on cervixes that didn't need to be done that could have consequences later on in life from over-treatment. So now we have loosened some of those guidelines and start pap smears at the age of 21. Those should be done every 3 years up until the age of 29. At the age of 30 to 65, women should get pap smears with HPV testing every 5 years or a pap smear alone every 3 years.
So more testing after age 30? Is that right?
Less testing after age 30. Every 5 years if you're getting the pap test with the HPV test.
Okay.
There's also recently, I think we'll see a shift in our society that will go a lot towards HPV testing. So an HPV alone test was approved for women over the age of 25 as the primary form of screening.
And what percentage of women out there in the United States are actually going every 3 years to get the pap
smears?
smears?
It's actually a lot of women do go every 3 years.
Really?
Or every.
I suspected the percentage was pretty
low.
But.
So a lot of people do get screened, and the Affordable Care Act and other kind of health expansions have allowed for preventative care to be covered. For women who have cervix cancer, the majority of them are not screened within the last 5 years. So that is what we are seeing, kind of the after effects of not being screened, is that you have those are the women that go on to develop cervical cancer.
We're talking with Dr. Erin Medlin from the University of Louisville. I saw something and heard something about vinegar being used to combat cervical cancer. Explain how that works.
So for women, it's mostly done in the third world or developing countries. That at the time, instead of doing a pap smear where you have to get samples of cells, they have to be read by a pathologist, and you have to then get those results back. For women who have live far and wide in Africa and other countries that don't have easy access to care, what they're doing is having them come in. They apply acetic acid or vinegar to the cervix, and they're able to see changes on the cervix that may be early changes for cervical cancer. And what they're able to do then is to biopsy or treat at that time, as opposed to having this waiting period where they may not find that woman again before she goes on to develop cervical cancer.
So it's a detection method.
It is a detection method. It's pretty good. We don't use it a lot in this country because we have better ways that people follow up a little bit better and have better means to get back to the doctor. But it is an effective strategy that's used in the developing world.
What's in the vinegar that makes cervical cancer perhaps show up? How's that work?
It helps to dry out the cells, and so you're able to see changes a little easier.
And is this being used all over the world in some third world countries, or are these just Americans that are doctors that are going to Africa and doing this?
It is being used kind of all over the world as a screening method. In the United States, what often happens is you do a pap smear. If that's abnormal, you get something called a colposcopy, which uses vinegar to detect those changes and do biopsies at that time.
Okay. What would you tell guys who have wives and girlfriends about cervical cancer and whether they should be the ones prodding their loved ones to go get checked?
And I would say to men that they are also candidates for the HPV vaccine. So it has been approved for boys as well as for girls, and they are.
And explain why that is.
The reason being is that HPV is communicated between the two, and so
sexually transmitted.
And although things like anal cancer, penile cancer, or pharyngeal cancer are much less common HPV-associated diseases than cervical cancer, they are still HPV-associated diseases, and they are susceptible to those. And so the HPV vaccine may benefit them as well.
But would you also tell them, I kind of interrupted you, would you also tell them, hey, tell your wife or girlfriend to go get checked?
Yes, tell your wife, girlfriend, get your children vaccinated, make sure they're keeping up with their pap smears and other things.
And any final notes to the women out there who are listening to this program about cervical cancer?
My final note would be that get screening when you're supposed to. And so it's really, as a provider who takes care of women with cancer, the greatest complaint that most people have is, I wish I would have gotten screening sooner. I wish I would have kept up with my doctor, or that I've seen a doctor a lot and maybe they just weren't aware that they weren't getting the screening they were supposed to have. So making sure that they're asking for that, be an advocate for yourself, and get vaccinated.
Very good. Dr. Erin Medlin from ULP and gynecologic oncology teacher at UofL School of Medicine. Appreciate you being on the show.
Great to be here. Thank you for having me.